I'm Dr. Scott Fuller. On this show, we're going to be talking about headaches and migraines. I'm going to talk about them together, even though the physiology of regular headaches is a little bit different than the physiology of migraine. You're going to find that conservative solutions, particularly with chiropractic, are very much the same. On my website, if you want to, you can go read about an article that I wrote on migraine headaches and the physiology there. I'm not going to focus on that so much of the physiology, but I am going to talk about conservative solutions for both regular headaches and migraines. Before I begin with that, I always have to give you a caution. If you happen to have the worst headache in your life and it comes on suddenly, and you might be having stroke symptoms with that, and you might know the acronym for stroke, F-A-S-T or FAST, where you get facial drooping, particularly on one side. You might have arm weakness, and you might have the other aspects of stroke, which is confusion. You might have slurred speech, S of F-A-S-T. It's time to call 911. That's F-A-S-T, time to call 911. So if it's the worst headache ever with some of those other associated symptoms, you could be having a stroke. So just keep that in mind. Okay. For the rest of us, you know that if you're a regular headache sufferer, if you have those tension headaches on a regular basis or the migraines, you already know your diagnosis, and we're going to talk about what to do about it. So, some testimonials. I want to take a couple of minutes and present to you some people that have had some amazing changes in my chiropractic office in Woburn, Massachusetts. The first one is Brian. You can read about Brian's testimonial also on my website. Brian was 9 years old when he started having migraines. Now, it's not normal for a 9-year-old to have migraines, right? So you should go have a scan of the head. And sure enough, he had a CT scan and everything was fine. Some headaches that he had lasted up to a week. His headaches were so frequent and severe, he missed 23 days of school in the 5th grade. He had a CT scan and neurology workups, which didn't reveal anything. He was put on migraine medication, but he was still having frequent migraines even while on the medication. He's an active child, plays hockey, and so forth. So finally, luckily, a friend of the family knows me and said, hey, take Brian to Dr. Fuller, try the chiropractic thing, nothing else has worked. So I did my evaluation, and what I did here is I started looking at the neck. Now, as you're going to see is a common thing, he didn't have any neck pain. He had no neck complaints. All he had were headaches. So I did my evaluation. I took the health history. I examined his neck, and I started poking right in here, more on this later, right in the upper neck area near the skull. And it was super tender. And he said, ow, that really hurts, and that makes my headache worse. Ding, ding. We knew that that was the cause of the problem. After several weeks of chiropractic adjustments, his migraines were gone. He does not need his migraine drugs any longer, and he does not miss any school any longer for headaches. He's been headache-free for 3 years, and he still comes to see me for wellness care. So that's Brian suffering for migraines at age 9. A 44-year-old woman, Ann Michelle, comes to my office. She has daily low back pain for one and a half years. So she initially called for lower back pain, but she also had headaches and migraines that started in high school 1 to 2 times per week. Once again, MRI and CT scans were negative. Her neck is often stiff, she said, and neck aches seem to cause headaches. So she already could tie in the relationship between my neck's bothering me, oh, and I have a headache too. So after 2 weeks of chiropractic care, her headaches have pretty much disappeared. After several adjustments in daily back exercises, she felt her lower back diminish, and she's still coming in once a month and so forth. So she's really happy with her changes. A 32-year-old man comes to see me. He had his first migraine at age 11. Then he's had 1 to 2 migraines a year for 20 years since. He would get aura migraines. Some of you that have migraines might understand what I'm talking about. You'll have the aura sensations like visual things or hearing things, but you won't get the full headache. He has aura migraines once a week for 2 months prior to chiropractic care. But he also had general headaches on top of the migraines. They increased in frequency, and then the headaches he had for months prior to care at my office. He went to several doctors. He was given a pile of medication, just like a lot of you. Furosemide, Excedrin, ibuprofen, Percocet, Klonopin, and so forth. He went to the ER, he had a CT scan, everything was negative, which is great news, of course. Blood and urine tests, even an eye test was negative. After 5 chiropractic adjustments, his daily headache was gone. Over the course of 2 months, he only had a couple of headaches. His migraine aura is now gone, and he's been headache-free for 6 months. Pretty cool. On the story goes. A 76-year-old woman comes to see me, Elizabeth. She came in 13 years ago. She had migraines for over 30 years. Her migraines, by the way, became worse after spinal anesthesia, after having a child. Her first headache may have come, she recalls, after her first period when she was 13 years old. Her migraines were twice a week, and once a month the migraine was terribly severe. She couldn't do anything, couldn't work. This might sound familiar to you if you're a migraine sufferer. Within weeks of starting chiropractic care, the frequency of the headaches dropped significantly. And she's now been almost headache-free for 10 years. She might get a migraine once a year or less, and it's usually associated with some sort of an illness. Pretty good, and she is thankful. I talked to her the other day, told her I was going to do this show, and she says, "I thank you every day, Dr. Fuller." Great results. Another one, a 48-year-old man. He's been a patient of mine for 20 years. So he came to see me 20 years ago when he was 28. He has had a headache every second of every day as long as he can remember. Now that's not normal. He gets his headaches in both temples and it feels like a vice squeezing his head. Sounds familiar to some of you, right? At age 16, he went to a neurosurgeon. He had a CT scan and an EEG, both of which were negative. He tried lots of pills, which didn't help, including aspirin and Tylenol. Now, this is the key point with this man. His headaches on a 10 scale, with 10 being the worst, his headaches every single day were 7 to 8. 7 to 8 over 10 before coming to see me at age 28. After a year of chiropractic care, we started to see some of the headaches each day coming down to a level 2 or 3. And over the past 15 years, because he's been a patient of mine for 20 years now, his typical headache now is 2.5. Now, is he headache-free? No. Has he had any period of time where he's had no headache whatsoever? No. But if you think about it, to go from a level 7 to 8 on the 10 scale down to a 2.5 on a regular basis, he said to me time and again, "Dr. Fuller, I can live with this. I couldn't live the way that I was before." And pills wouldn't touch it. So pretty cool, 7 to 8 down to a 2.5. He still comes to see me every 2 weeks, and that's been 20 years of care. A 30-year-old man, his problem started 5 years ago with right ear pain. More on that in a moment. He had a couple of ear infections. He went to an ENT, and he was diagnosed with a TMJ problem. And he does seem to have a TMJ problem on top of his headache issue. Pain then started to migrate to the neck on the right side and then into his upper mid-back on the right. So he has a variety of pain areas here, and this might be familiar again to some of you. Pain here, he explained pain across his face sometimes, into the neck and then down into the upper neck and the shoulder. Pain is worse in the morning at 6 over 10, 3 to 4 over 10 during the day. A very astute massage therapist that was working on him said, "Hey, I think you need a chiropractic evaluation." So the massage therapist, good job on her, sent him to see me. After the first chiropractic adjustment, his neck pain on the side here decreased from a 6 to a 4. Shortly thereafter, it went down to a 2, and it's a much smaller spot. So the pain doesn't radiate anymore down into the upper back and so forth. He only has 2 spots now, here in the upper neck and then here in the jaw, and it's now only a level 2. We're still working on it, and we hope that the rest of that will go away, but a nice result there as well. The next one is an 11-year-old girl. She is brought to me with ocular migraines. Again, this might sound familiar to some of you. So she gets the aura, the visual changes associated with migraines, but she doesn't get the headache. Although one time when she had her ocular migraine, she did get a headache on this side of her head. And sure enough, when I did my evaluation, I found tenderness here. And when I pressed here, guess what? It made the headache sensation worse. So after each of her 3 ocular migraines, I did chiropractic adjustments here. Ocular migraine is gone. So you can see that there's a variety of different headaches here, different ages, different presentations. All of them did respond very well to chiropractic. The last one I wanted to mention to you is a 53-year-old woman. She was 53 when she came in to see me. She's still a patient now, and now she's 69 years old. She had headaches and migraines for 30 years. They used to come in bunches, as some of you have experienced. She would have several headaches a month, and she only tried drugs. She started with me in 1999 and had some quick progress. The frequency of the headaches came down very, very quickly, but then she got in a car accident and got rear-ended, which flared up her headaches. More on that a little bit later. But then we continued with our treatment, so the headache frequency dropped again. And now she has been headache-free for several years now. So another great result after 30 years of migraines. Very, very good cases. So I could go on, and as I was going through my patient files, I just realized we've helped hundreds of people, chronic headache sufferers, get really well and get conservative improvements. So what do you do for them? Well, you could take drugs. So a little bit about that. You could try acetaminophen, Tylenol. Side effects. Acetaminophen doubles the risk of blood cancers, may cause liver failure and death. 1,000 capsules of Tylenol in a lifetime doubles the risk of end-stage kidney disease. 51% of United States acute liver failures are caused by acetaminophen, 51%. We now know acetaminophen increases high blood pressure. Older women who consume 500 milligrams or more per day of acetaminophen for headaches have a 240% increased risk of high blood pressure. And younger women, as compared to people who do not use acetaminophen, by the way, and younger women who consume over 500 milligrams per day of Tylenol or acetaminophen for headaches have a 370% increased risk of high blood pressure. Catch this now, pay attention. We now know Tylenol and acetaminophen are linked to increased risk of autism and autism spectrum disorders. Evidence that increased Tylenol and acetaminophen use in genetically vulnerable children appears to be a major cause of the epidemics of autism, attention deficit with hyperactivity, and asthma. And one of my colleagues said, based upon these studies and on the treasure trove of additional references found, I would suggest that pregnant mothers and children not be given any products that contain acetaminophen ever. And there's at least 5 very good studies linking acetaminophen and autism. Or you could take nonsteroidal anti-inflammatory drugs, or NSAIDs, which include ibuprofen, Celebrex, Voltaren, naproxen, and aspirin. You could take those instead. You could. So, nonsteroidal anti-inflammatory drugs, all the drugs that I just mentioned, conservatively cause 16,500 Americans to bleed to death each year, making it the 15th most common cause of death in the United States. You could. Those who consume the highest amounts of nonsteroidal anti-inflammatory drugs increase their risk of dementia, including Alzheimer's dementia, by 66%, and that's out of the medical journal called Neurology in 2009. So we're already known for 5 years. Your rates of death go up by taking those, and your risks of Alzheimer's go up significantly. Or chronic daily headaches with analgesic overuse. This article out of, again, the Journal of Neurology in 2004 says people that are using these common painkillers actually have more headaches because of the rebound headaches. And here's another article, Caffeine as a Risk Factor for Chronic Daily Headache. Many of you that are regular caffeine users, you know if you go with a day without any caffeine, oftentimes you get a reflexive headache that occurs. So we want to be careful with that too, all right? Caffeine. Now, the issue with caffeine is some people who intake caffeine and they decide to go without it, they find that when they get off the caffeine, they'll go through 3 or 4 days or even a week full of withdrawals from the caffeine, and that can be a problem. But you can get over the hump, and that's the idea here. Okay. So let's take a few minutes and talk about solutions. How does the chiropractic work so well? Not in all cases, but how does it work so well for headaches? What is the deal? Let's take a few minutes and explore that. And I'm going to go to one of my drawings here. Now, these are museum quality drawings. If you've been a watcher of my show here, you know that my drawings are just awesome. And that was a joke. But anyway, so this first drawing here describes what is going on in the spinal cord in your neck. Now, this is very important here. This is the issue between the connection of head pain and the condition of your neck joints and discs. You're going to see that they go to the same spot in the human brain, in the human nervous system, in the spinal cord, which then can cause headaches. So what's going on here is deep inside your spinal cord, in here, in the upper spinal cord, you have a switchboard, this information center that's receiving calls. It's receiving calls from the forehead and face, and it's also receiving calls from the structures in your neck. The structures in your neck are all the things back in here in the skull. The structures in your neck include the joints in between the different bones of the spine, the ligaments that wrap around those joints, and the tiny muscles back here below the skull. Some of you know those muscles as the suboccipital muscles, okay? So that area in the spinal cord is receiving calls from here and here. They go to the same spot right here in the spinal cord area, okay? So what's happening is when that switchboard is receiving this information, whether it's from, let's say the forehead area or the upper jaw area or the lower jaw area, this information from the head and face is talking to some nerve guys in the spinal cord. Well, these nerve messengers also receive information from cervical bone number 1 area and the associated soft tissues, and the number 2 and the number 3 way up in your upper neck. So the neck joints and discs and muscles and tendons and so forth also send messages to the same spot. Here's the key point. I'm a person on a track, and I'm about to get my baton handed to me, and I'm not looking who's giving me that information. So I get the baton, and I start running, and I bring that information up to the brain, and I say, hey brain, here's some pain information. The brain asks me, the messenger, says, where did you come from? And I think, I'm not sure, I wasn't looking. I either came from the head or the temples or the eyes, but I could have also come from the neck. And the brain thinks, what's important to me? You know, the head is more important to me. I'm going to light up the head area and give you pain here. So the messenger says, hey, you're the boss. You can decide wherever I'm going to have pain. I'm just giving you the message. You see? So there was almost a crosstalk. The call came in and the information came in from the neck joints and discs because they were inflamed, came in and talked to the messenger. The messenger brought it up to the brain, and the brain interpreted that as a headache. There must be some sort of a problem in the forehead and the temple. But the call actually came from here. The interpretation of the call was interpreted as a headache. That's why some of these patients that I mentioned earlier can have no neck pain at all, none whatsoever, no neck complaints. How does your neck feel? Totally fine, but they actually have a headache, and there's no pathology of the head. We can examine the skull, we can examine the temples, we can examine the skin, we can give them a CAT scan, an MRI, blood tests, urine tests, whatever, and in most people, with exceptions, there's no pathology here whatsoever. Nothing is found. The problem is with the joints and the discs and the neck sending that information up and being misinterpreted by the brain. That's one example of how that crosstalk happens. Pretty interesting. The other example I use is people with leg pain or sciatica. oftentimes they only have leg pain and there's no low back pain. They say, I have pain in my leg. Please look at my leg. And we do examination of the legs and tests of the legs. We could take x-rays and MRI of the leg, and oftentimes there's nothing wrong with the leg. It's all coming from the lower back, but there's no lower back pain. The brain interpreted that little crosstalk as a leg problem. Also, phantom limb pain. Somebody loses an arm or a leg and they have still pain in that missing extremity. Well, that's a real phenomenon because the brain still thinks that the arm or the leg is there. And oftentimes they can actually have pain in that limb that doesn't exist anymore because that's what the brain is giving us for information. You follow? That means that dysfunctions in the neck can cause the headaches, and that's what happens in most cases. So in most cases, you have irritations to the joints and the muscles and the tendons and the ligaments and even the coverings around the spinal cord and brain called the dura mater. That thick covering can be a cause of pain as well. We'll look at that in just a moment. And the softer covering around the spinal cord and brain, the pia mater, you don't need to remember all those terms and so forth. Just the coverings over there can also be pain generators interpreted as headache originating from problems here. Interesting. Let's look at my second drawing. And what we're going to do here is we're going to see some of the anatomy, some of the complexity going on in here that's causing all of this. I don't expect you don't need to know all of the muscles and tendons and nerves and so forth. I just want to let you know, the point to take home is there's a lot going on here. This is kind of the ruler of the circuitry in this area, and that is causing these headaches. So let's take a look. So on this drawing here, what I have is the back side of your neck. Okay, so here's the back side of your neck. Here's your skull back in here. Here are those little muscles right in here, those suboccipital muscles. There's a whole bunch of them. I just drew a few of them. A lot of you will know this is the trap muscle way up attached to the base of the skull. Here's the muscle on the side of your neck, the SCM muscle that a lot of people know, the sternocleidomastoid muscle, SCM. So there's a bunch of stuff going on here, and these are just the muscles. Okay? You also have a ligament wrapped around one of the joints between cervical bone number 1 and cervical bone number 2. So that's the cervical bone number 2 here, cervical bone number 1 here. Here's the joint in between, and this is the ligament that wraps around it. So this ligament gets inflamed, and it sends information into the spinal cord and brain, which hurts. You can have neck pain from that, of course, but you can also have a headache from that. You can also irritate this particular nerve right here that goes up into the back of the skull. This is called the greater occipital nerve, meaning in the back of the skull. So it supplies all the skin and so forth back here. And that's why some of you that have regular headaches will go to a massage therapist or even do some self-trigger point work, usually up in this area here, because you can see that that nerve pierces the trap muscle. So if there's scar tissue and inflammation and injury from, stuff like poor posture and so forth, we're going to get to that in a moment. When you have irritation and inflammation here, it squeezes on that nerve and it causes all sorts of headache sensations. You see? So this nerve here can be trapped by the sternocleidomastoid muscle, the trap muscle. It can be inflamed down here by the capsule joint in the neck. You might not have any neck pain here, but you might have pain in the back of the skull. I have a patient with that just this week. So we're working on it up here, and we're seeing that headache sensation get better. You can have inflammation to these muscles all in through here, which will send pain information into the spinal cord, and then boop, up to the brain, and you get the sensation of a headache, but the problem is here. You can have misalignments of these bones. These are out of alignment, causing irritation and tugging and scar tissue on the tendons and ligaments and muscles in this area. That can generate pain. You've got another joint here and another one here. Oh, between cervical bones 2 and 3, you've got 2 more joints down here, which I didn't draw. And they can become inflamed, send more pain traffic into the spinal cord, up to the brain, giving you the perception of pain well away from the cause of the problem, which is irritation of the structures in here. That's the important point I want you to understand, is Irritation to these neck structures here is sending the pain information into the spinal cord and up to the brain. Your brain interprets it as headaches, most commonly temples, forehead, behind the eyes. There's no problems here. The problem is here. Some of you might have neck pain, some of you might not. The cause of the problem is here. Hence all those cases that I just told you about. I start examining this area, find the problems here, and then off we go to finding solutions. So, how does this area of the spine get messed up? How does it get messed up? Say the 9-year-old that came into me, right? Brian that came in. Well, how did he get this big knot in his neck here, and how do those joints become dysfunctional at only age 9? That's a great question. I go over this with all of my patients that come into my office. And it's basically life. It's life itself, right? So, childbirth. We are obstetrically manipulated or suctioned or forceps or C-sectioned out of mom. There's our first trauma. When should we check that? At age 9? At age 60? Or earlier than that? I think earlier than that would be smart. So that can build up over time. And then we learn how to walk and we crash. And then we learn how to run, and then we really crash ourselves. And then we fall off our skateboards and we sled into trees, and then we play sports and we knock ourselves around and so on, and fall off playground equipment and so forth. And then we get the newest one, which is text neck, right? Text neck like this. And then we go to school like this for 20 years. And then people come to me and say, you know, Dr. Fuller, I don't know what happened to my neck. I wasn't injured at all. But boy, I'm getting these headaches. Do you have any neck pain? No, don't have any neck pain. But boy, I get these headaches all day long. Then you watch my show and you realize, oh, this makes total sense now. This has been an irritation ongoing from all of the things. Oftentimes it's a combination of everything that I just mentioned, which causes pain and inflammation in this area, giving you maybe neck pain, maybe not. And then that can be the cause of headaches and migraines. So what do we do about that? What I do in my office is I say, well, let's look at you head to toe. And most people that came in to see me, as you can see with all those testimonials, they've already had the MRI and the CT scan and so on and so forth. But then I'll do orthopedic neurological examinations of the spine. I will do range of motion and so forth. Then I'll start doing my chiropractic checks. The chiropractic checks include posture. You might have a posture like this. And I'll say, stand up straight. And you say, okay. And you're like this forever. Or the classic one, of course, is from the side, right? Like this. Everybody's like this. Scrunched up like that and so forth. Okay? So those postural things we'll look at. Then we'll take x-rays. I'll show you the x-rays if we need x-rays. And then we'll look at the alignments. We'll see if you're this way or that way. Or we'll look at the curve in the neck and see, do you have a good curve or not? And most of you don't. Myself included, we all need to work on the curve in the neck and our upright posture. So we do the evaluation, the chiropractic checks, the posture, the spine, the x-rays. I'll poke around in here. Usually we find tender spots in there, even though you don't have neck pain. And then we'll put you on a program of care. The program of care in my chiropractic office is chiropractic adjusting. Now, if you haven't seen my show before and if you have not been to a chiropractor, does that mean you have to have those popping and cracking adjustments that everybody thinks about at a chiropractic office? Not necessarily. You don't have to have that. We have other tools in our toolbox. Like physical therapy, they don't do just one thing. They have several things that they can do. We have several things that we can do in the office and at home, and I love to show people homework that goes along with their in-office treatments so they can get the best benefit. The important point with this is not to stop care early. If you think back to some of those testimonials that I gave you, it took many months, and in the case of a few of them, a few years before they got the results that they were looking for. So after the chiropractic evaluation, stick it out for a while. Even though insurance companies will maybe pay for medications for years and years and years, they don't pay for chiropractic care for years and years and years, but you might need extended care to get the results you're looking for and see if we can solve those tension headaches and those migraine headaches. I'm Dr. Scott Fuller. Please join me again.